everybody thinks it's just the ear infection type thing and that it's simple, and there's not, it requires its own like special skill set. Like there's, differences in family dynamics, medication dosing for literally every kid. No. I am 100% a mom. Our girl did get sick. It's been a little bit now, but I literally said my NP brain took a trip to Mars. I knew nothing. I've been a student, really, there was maybe a 1 to 2 year break between my bachelor's in nursing before I started back. I've been a student what feels like forever, because I have been.
Guys, welcome back to another episode of the Device Girls. Today we have on a lovely guest, Kenadee Canada. She is a family nurse practitioner and works in pediatrics. She's also working on her doctorate of nurse practitioner and is a professor in nursing school. So she does all the things, and today we're going to deep dive into it. Thank you so much for joining us today.
Thank you.
Well, thank you guys for having me.
Of course.
So if you'll introduce yourself, just give a little bit of background about yourself and what you do.
Sure. So I am a nurse educator and a family nurse practitioner currently in a pediatric clinic. And then, of course, that means I work about 2 days a week there while also working as an instructor and clinical site coordinator for our traditional undergraduate nursing program here at one of our local universities. So that's kind of the big things on top of recently earning a new title of mama, this last year.
Yeah.
Yes. Congratulations.
Doing all the things.
What drew you to pediatrics?
So, I started my nursing career in the neonatal intensive care unit or NICU. And that's where I stayed for 8 years until this last year, honestly, in January. So it kind of came to the time of realizing, something's got to give. I can't continue to practice as a registered nurse and do, the other hats of NP and educator, site coordinator, mom, all those things. And so sadly, had to let one thing go. And so I think it was kind of there, of course, where that love for pediatrics, naturally began. And so I think just continuing education wise and learning more things and even working with families in that environment as a registered nurse, it was easy, I think, to evolve into where I wanted to continue with families, working with them, like far beyond the, that newborn phase where we're hitting all the development milestones.
Yes.
And I think that's been really cool.
Yeah. What was your, what was one of the best lessons that you learned in neonatal that, translated for you into pediatric care?
I think genuinely how to work with families. Like I think, it's easy to learn the clinical side of things. I think sometimes it's harder to learn the human side of things and how, how do you work with, in a general sense, even older patients or, in my sense, how do I work with families, and partner with them to make the best things happen for, not just their kid, but also them, and that takes into a lot, there's a lot of things we consider. It's not just health, it's finances. It's, what does that look like for you? How can we make this work? And so I think that kind of starting point for me and just getting those, foundational skills with working with parents and learning how to educate them really kind of spearheaded a lot of, I think, what comes later for me. I think that would be kind of the way I would go about that part.
Yeah, that's amazing.
What made you want to become a nurse practitioner going from being just a registered nurse?
So it's always funny. I have a picture like from when I was 4 and it says doctor, like I'm holding it up. I've got that cute little stethoscope on, and I think it was always kind of that God woven design plan for me. I knew forever, I've never changed that thought, that I was going to be a healthcare provider, we'll say, because obviously I ended up not doing medical school. And that actually switched for me in college because I thought, I don't want to go to school that long. And then I think, that was like, joke's on you because I did go to school that long because I decided, I like education. Maybe I'll do that, nursing education program first. So I did. And then it still was in the back of my mind, like you want to reach further and do more as a healthcare provider. And so then it was just, of course, I'm going to do NP, now I'm going to start that. And then of course, at that point, I think it's easy to, especially when you work in academia, it's easy to continue that thought of I want to do more, I want to reach more. and how do I get the tools to do that? And that's kind of where the DNP came in for me for that piece. It really gave me the tools to continue to push those dreams.
Yeah. So what will be that differentiator for you in the level of carrier scope when you achieve your doctorate?
So I think there's some kind of misconceptions about that. There's different tracks as far as the DNP goes.
Okay.
In the sense of like as a clinical provider, like what you do for patient care, that doesn't necessarily change much.
Okay.
You know, as an NP or, you know, that's the clinical, I'm taking care of patients. Whereas the DNP is more about learning like leadership, systems improvement, and then of course, how do I better translate evidence into practice? And so you're kind of trying to lead teams then, like you're rolling into making big changes, maybe in your clinic, maybe in an organization, but it's not necessarily going to change how you take care of patients. Except for the fact that, yes, I think you might be grounded a little bit more in that evidence stuff because you're heavily looking into that during your program and after that. So,
And how long is that program for you?
Well, again, for me, I did the roundabout way for school. And so since I did that master's in nursing education first and then decided to do the postmaster's F&P, that was actually when I decided, you know, if I'm going to be in school for another 2 years just to finish that NP, it felt kind of silly to not get a higher degree, you know, instead of just the certificate that came with that master's that I already had. And so I asked, like, can I merge these two programs? So I think the normal program, and don't quote me on this, I think the normal program is maybe like 2.5 to 3 years, depending on where you go. For me, it was a little drawn out because I did NP and DNP at the same time. And now I'm just kind of in the what classes do I have left phase. And so I graduate in May. I'm very close.
Congratulations.
I'm very close. And I have one more class in May or before I graduate in May.
That's amazing.
That's awesome.
That will be so exciting.
I'm very excited.
You'll never be like it's a student again.
I've been a student, I think. I mean, really, there was maybe a 1 to 2 year break between my bachelor's in nursing before I started back. I've been a student what feels like forever because I have been.
That's good, though. Should always be learning.
Oh, absolutely.
Well, I think that's part of healthcare, right? Like we are continuous learners and we should be. That makes us safe and good providers.
Absolutely.
But I think the stress of being like how that learning looks, I'm ready for that change.
I'm sure.
How that looks might be better for me after May.
I don't have an assignment due tonight.
I do love learning, but I'm not the biggest fan of the due dates.
Right.
You know?
Absolutely. And that's just got to be wickedly challenging to juggle all of that. So hats off to you because that's amazing. Wow.
What got you into like becoming you're technically a professor, right? So what got you into teaching?
So teaching, so this is also something that the common public people would not know as well, but there are tiers to our rank. And so technically I'm an instructor. And then you can rank up and do, you know, you meet certain criteria factors and then you can kind of work your way up to, you know, assistant, associate, professor, and then just full on professor. But yes, teaching wise, the general answer, you asked what I got into for that.
Yeah. What got you into that?
I think the NICU starting with families and then, you know, it kind of rolled into students that just came in for their clinicals or new hire nurses that I was training and precepting. And I realized I was good at it and I really loved it. And so I think that was kind of where I ended up deviating off of the plan to do NP first. That was probably what, sent me to that education route first because I knew those courses would matter and I knew it would help me ultimately kind of do that piece of it. And I was like, well, I can do both. Like I can do all of it. And so I think that was just kind of the big piece for me. And there's something about, you know, seeing the student kind of like evolve and, you know, doing all those things. I saw it even as a nurse on the floor before I became an educator. And it was so rewarding, you know, to be able to like see the light come on and then like them feel more confident. And, you know, that's just something so special that you just can't. I feel like, you know, some people are educators, some people are not in healthcare. And if you have it, you have it. And I think it's one of like the motivators to keep on, even when times get a little bit tough, even at the bedside. So,
and I think like how rewarding for you as well, just the amount of patients that you're actually going to be touching through others,
It's true.
and by, facilitating others to be really good nurses and teaching others.
I mean, you're truly like playing that small role, the small hand in shaping our future caregivers of our community. And so it has far reaching benefits like for patients. It's not just about the student. It's ultimately about our community and our outcomes and how we all, I want that care, if I end up in that setting, I want the people taking care of me to have similar, mindsets and foundations that they're building on. We learn, the knowledge of the textbook material, and that's kind of the foundation for our care. But really, it's how do I work with students and leave an impact that, it's not just about that. It's also about how do I view and treat my patient, every patient, like they're my loved one.
Yes.
And it's that compassion driven piece that's not necessarily taught, in the material per se. Like you're not going to necessarily read that word for word, like be nice, but I think showing that, demonstrating that, and then empowering them to feel like that's something they can also do and see what it changes for their patients. And so I think that's definitely a great way to look at it.
Yeah, absolutely. Do you feel as though as a nurse instructor, is your day like more so in a classroom, or do you do precepting work like in the hospital in different units? What does that look like for you?
So my days definitely vary. Like, I think there's different pieces because obviously more hats that I wear. Every day can look a little bit different, but in a general sense, yes, it could be me being in clinic as an NP. But also it's, clinical coordinator wise, maybe I am talking with clinical sites or trying to get new sites and working with them. I'm developing schedules, determining clinical placement, working with our faculty to, change processes, make those better. Meetings, I'm on committees. There's different things that I, participate in as well, not just as faculty. And then of course, like the normal things, right? Like maybe I'm proctoring an exam, grading for sure. And then the biggest one, I think, for at least where I teach in the program, it's the very last semester. So our students are heavily in clinical. We actually don't have lecture. It's great. And I found I actually really love that because I think clinical is really my thing. And so, the clinical setting and getting to educate in that way is definitely my favorite thing. So rounding on them in the hospital, I pop around to multiple places, day shift, night shift, all the things. And so it could definitely be a mix of all of those things. And then of course you can never forget the student part for me. Then it's my assignments, working on my project, doing things like that. Sometimes I have clinical hours. So those things get added.
I love that still connects, like it keeps you connected to so many different specialties in the sense, and like just you're not solely always just in pediatrics. Like you also get to, be a part of other things in your day-to-day as well.
And I think too, people have asked me that, like, why didn't you do neonatal nurse practitioner or pediatric nurse practitioner? Why family? And I think that was definitely why, I wanted a wide variety of knowledge because of me being, the teaching side too. And it really did. I mean, I feel like it was noticeable to me just finishing the FNP program, like, wow, like I am able to even more so relate to these patients and really walk them through different stuff. Not that, I already couldn't do that just as a basis for what my role was, but I really felt like I could connect that at that point, direct patient care. I was doing that, at the time. I was doing lots of clinical hours with them, technically, not in the same place. But I think it helped. And I think even now it continues, like to where I'm not losing that side of it. Yes, I'm in a pediatric setting. But I think too, can't forget those kids get older and they have, they have just as many problems sometimes as some of our older adult populations do too, depending on what's going on. And so it's not just, an ear infection or tummy bug. Like there's definitely some pieces that always kind of pull through and you're thinking about more things than just like what you would expect for a pediatric patient.
So when it comes to the programs and the schooling, how is that family nurse practitioner different versus like a pediatric or a neonatal NP specialty?
So they're very different. So family is cool because technically it's pretty like broad where I could go with that. And there's a lot of settings I could work in. Now there are exceptions to that. I could not work in like the NICU.
Okay.
That one only is the neonatal.
Okay.
But like family wise, I could do dermatology. I could work in cardiology. It kind of allows me the opportunity to go in different areas if I wanted to. But if I only chose one of the very specific specialty programs, I could only work in pediatrics. I could only work in the NICU with neonates. And so I think that is kind of the main difference. So like class wise, they just focused on that population. Mine is everything. And so that was, again, helpful for me, like learning wise, and definitely why ultimately I decided that route.
Yeah. I love it. So let's deep dive a little bit into your day in the life in the pediatric office, just with all the little kiddos.
I would say like every day is so different. Yeah. And it's sometimes super fun and like funny and exciting, and other times it's kind of hard. But it's just, it really can be anything. And so I think just reminding people again, it's not just the ear infections. Like sometimes it's injuries, it's chronic conditions, helping, manage those as well. And then again, the big piece that is sometimes the sad piece is, how do I maybe wear a little bit more of a hat with things that technically go far beyond, just the clinic. And it's, how do I decide what I can do for them when they can't afford it?
Right.
Or their insurance is denying it. And it's like, okay, well, where do I go next? Because sometimes these are life-saving medications, and it's like, that's not an option. And it's really the time spent it's me researching, and I'm trying to find like, how do I prevent them from going to the emergency room?
Right.
Getting admitted to the hospital, or, a far worse outcome. Like that's a huge thing. And so I think sometimes people forget that piece of it too. Absolutely. It's kind of the hard thing that would be about, the everyday job of that. And it is probably, I think, one of the biggest challenges that most providers in our area kind of have to work through and figure out what that looks like. Because, you do, like, you take that home, you think about it, and you worry about it because there's only so much you can do.
Right.
And then at the end of the day, this is a vulnerable population. And it is what it is. And so I think that's kind of the big thing that's sometimes forgotten. Yeah. And it's also like a huge driver of like, sometimes you wait a little bit longer, and it's because there's something going on like that, or something acutely wrong that needs to be addressed, and it's going to take a little bit more time. But that they deserve that. You would want that if you were the mom in that room. And so I kind of just think about it like that, and I think that's kind of my like day to day. Getting emotional. I think that's kind of like my day to day.
Yeah.
Well, it's so interesting to hear you say that, because I didn't really ever think about like in family practice that you guys are affected by that so much, but because like we see it all the time in surgery, and it's so frustrating that like, and not to get on an insurance talk, but care is dictated by insurance, or that people can't get the care that they need. Like we run into it all the time with like cases that we have, and it's like, this is what the patient needs.
Yeah. And sometimes it means defaulting to the option that's not the best option.
Exactly.
100%. But it's your only option.
Yes.
And that's frustrating.
Yes.
It's heartbreaking when your job is to want to take care of people. And then you're stuck because it's like, you can't, there's only so much. And so, I think for sure.
Yeah. And that's even something like, I didn't even really realize or think about. And Abilene, we have quite a population of, there's not in the situation to be able to, pay for those sort of, that's.
And and honestly too, and just thinking about like in all fairness, even people who can, why should we have to pay $300, $400 for a medicine that's a life-saving one? I'm like, that's crazy.
Because even if you go like cash pay,
that's overwhelming for people, even if they have the means. That that's still a hard hit. It's definitely a huge driver, I think, across the board in healthcare, and how all of us all approach visits, cases, patients. That's how we have to look at it.
Yeah. How do you? Let's lighten the mood a little bit. How do you connect with a lot of your patients are kids. So how do you connect with them? Like, what are ways you've learned to because obviously they speak a different language than grown adults. So what does that look like for you?
Sure. It's just coming down to their level.
Yeah.
Obviously I know some words that, that mean, smart medical things, right? But
Yeah.
they don't know what that means.
Right.
I do try to always, I think there's value in using the real word first and then explaining what that is. That's part of learning for them too. But it's just leveling with them and then being honest about it too. Sometimes this is like not going to feel the greatest. It feels a little yucky, but this is why we're going to do it. Because lying's not going to help you. And then it really is not going to help you next time they come in, trust you.
Right.
And so I think that's kind of the biggest piece of it. And then, meet them where they're at. If they, want you to listen to that doll, you're going to listen to the doll, and so you're going to do that first.
Yeah.
And that's, that's your trust builder too.
Yeah.
And then they come in next time and they're hugging your leg, they love you. And it really does. It helps. Like, how do you become their friend?
Yeah.
Because ultimately it's really hard to assess a kid that doesn't feel like you're their friend.
Right.
Or want to be their friend. And so I think that's a piece too. But also, of course, you're still talking with mom, talking with dad. And I just treat everybody, no matter what they do, where they come from. I treat them like they know nothing. I want people to do the same thing to me, because maybe there's something I could still learn.
Yeah.
Right.
And so I think that's kind of the mindset I use. And then, of course, always just pulling it down to like a general, anybody could probably understand what I mean, education level.
Yeah.
So
do you feel like all the tiny friends are they're excited or they're more hesitant when they come in?
I think that depends on the age.
Yeah. Okay. No, that's interesting actually. So what like milestones in age do you feel like are like very receptive, very open to, wanting to see people? And then also
I think like they live in that stranger danger period for a while, that like, middle infancy when they get a little bit old, like closer to the 9 months and up to early 2, it's still kind of like touch and go. But then I think when they're starting to be even themselves like socially around more people, maybe they're starting like daycare or, I think those pieces kind of help. Because it's not just like my world is not just mom now, like there's other people already. So I think that helps. I think the more they see you again, they start to feel a little bit more comfortable. But yeah, I just think every kid is going to be so different because it really just depends. Like what happened last time they came in matters.
Yeah. Yep.
Immensely.
It does. No,
did we get a shot?
Yeah.
They don't forget.
I was that kid.
Yeah, they don't forget. So I think it's just kind of that area in a general sense.
Yeah. Oh my gosh, that's so funny.
This is kind of a side question, but how are you with needles and everything? Because
they do not bother me.
Really? Because we have people come in that are like, or that we talk with, and they're like, I hate needles, but I can sit there all day and like stick them in other people, and I'm the same way. Like I can sit there and watch it, but to have it done to me, I'm like, nope.
No, I don't think it's ever like my parents might speak otherwise. I don't recall ever having an issue with it when I was little, and I don't now. Like they don't really faze me. I will say they're. Because it's not the needle, it's sometimes the medicines or the fear. So the fear of the needle, that's why you're crying.
Yep.
And then sometimes it is maybe the medicine.
Haley.
Yeah, sometimes
that's why
it's the medicine because some of them do hurt a little bit more when it gets pushed in. And I have experienced that and I don't love it. You know? And it's like I wouldn't sign up for it willingly, but I'll take it if I need it.
Oh, yeah.
But I think that's kind of everybody's a little bit different on that, but I think fear would be the number one driver.
Oh yeah, that's me with getting my blood drawn. I'm like, are you done yet?
Yeah. Now that you're a mom, do you feel like you are how should I word this? Now that you're a mom, do you feel as though like when your kiddo gets sick, you're like more, oh my gosh, or you're calm, you know what to do, you're like, no, it's fine, it's just this, what's your response?
No. I am 100% a mom. I literally, so our girl did get sick. It's been a little bit now, but I literally said my NP brain took a trip to Mars. I knew nothing. It was the worst thing possible that was happening for sure.
Yeah.
Even though like the back of your brain is like, come on, like you know exactly what this is, but like it just like that sense of like rationalization just goes like because you just love them so much and it's like, am I right? Even though like I know I am, but it's just I don't want to be that person deciding that. Right. I made a pact for myself a long time ago, like don't buy anything for the house. If something is wrong, you're going to be a normal mama and you're going to go into the clinic like everybody else. And so I kind of like told that because everyone's like, oh, just buy something. And I was like, no, I'm not going to do that. Like, I don't want to be the person that's deciding if everything's fine. Like, because
it's good. It's good to have
your judgment is so clouded. Even though the back of your mind does know, but it's just, I don't want to be the one that decides that.
Right.
You know? I want somebody else to confirm that for me.
Mhm.
Yeah. It's so like weird because I don't have kids yet. So I don't even know what it's like. I have a dog mom, which, but so
with the milestones for kiddos, what does that look like for y'all in regards to when, or kind of your intervention on encouraging care if, a kiddo is not maybe measuring to a specific degree in
I
those
think
steps?
that is going to vary.
Okay.
It's really probably why. Like, is there something that is an easy answer to why? Like, that's where we're going to go with that.
Yeah.
And then it's just kind of, sometimes we monitor and then work with their main provider. Yes, we do well checks as far as the nurse practitioner goes, but sometimes those are some things that if it's not an obvious thing, I'm probably going to default to the main provider because they know this patient.
Yeah.
They've taken care of them numerous times and we're going to work as a team then, and we're going to figure out what's best for them. And so I think, it's really hard to answer the exact piece of that because I think it's definitely just going to depend on what's going on. What's been done? What can we do? What options do we have? And so it's really kind of the team approach on those when it's not the obvious.
Yeah. Okay. Yeah, that definitely makes sense. We with Sloan, I mean, there were some things, and that not speech wise, he just took off after mama, and it was like okay, which I was definitely, that was a concern for me because apparently they say boys are. Is that a myth? Can you debunk that? Are boys like more delayed than girls, or is that something
like in a general sense? Or
yeah, so just like hitting
Are you talking
milestones.
with speech? Are you talking like with speech or just?
Well, just even like various milestones, but yes, I guess primarily with speech.
I mean, I guess maybe I just haven't been around long enough to feel like I've noticed a difference in that. I think I notice more like older siblings have a huge influence on speech development for some kids.
Okay.
What are we doing as far as like, are we reading those simple books with the pictures and those simple words? Are we doing, and then sometimes too, like, I think girls just naturally, we like to talk, I think we like to talk, and like boys are kind of like, I don't care. Like, I'm just trying to play. You know?
Yes.
And so I don't know. I think there might be pieces to that, but I can't say I've noticed personally any major difference as far as that goes.
Okay. That's good to know.
Interesting. Yeah. Sloan loves to just sit with his transformer. He got both though.
Yeah.
He got both. Because he's yappy too, like his mom.
He's yappy, and he's very yappy. Which I love. I love it. Like, I mean, sometimes I'm like, oh my gosh, what did I do? Because I mean, he'll yap with me all day. I mean, like, just crazy. But yeah.
I love that.
What is the biggest misconception about pediatric care?
So I think that's still kind of everybody thinks it's just the ear infection type thing.
Okay.
And that it's simple, and there's not, it requires its own like special skill set. Like there's, differences and family dynamics, medication dosing for literally every kid, communication pieces. So it's kind of some of the things we've talked about, and I think that's the misconception, that it's like a black and white visit maybe. And there's just so much more to it.
Yeah.
And like, yes, sometimes they have chronic conditions too, or, serious things that are going on as well. And it's not just kind of the natural, like, we do treat ear infections and fevers. We do have tummy bugs, but I think it's forgetting there's other pieces of that too.
Are y'all really involved with like working with other providers and other specialties, just, based on the condition that a child presents? Like if you need,
I mean, we definitely refer.
Yeah,
we definitely refer when needed. I wouldn't say there's, at least in my position, I don't feel like there's as much like communication on that sense. It's just, I can definitely refer, and then they'll continue to follow if they need to. And then it's like, there's some updates back and forth on that. But there has been a time that, I called a specialist because I needed to understand what they had done. And so I did talk to one of the a doctor in another town that they had seen and were referred to. And so I wouldn't say it's like off the table. But I think at least in my role as a nurse and nurse practitioner, I haven't really had as much of that piece as more as, I definitely put referrals in for stuff, but.
So since that's like a big misconception, can you give us some like vague examples of other things that you may see like in your clinic?
I think like in a general sense, like it can be anything and everything under the sun.
Okay.
You know what I mean? And so it's not just like the immediate sick visits. It's like, of course, like injuries is a really common one, right? That you're going to see in kids, older people too, but kids because they're just more prone to those accidents and sports things and things like that. And then of course, asthma, there's diabetic kids, there's just different pieces of like, it's not just kind of the normal sick stuff. Like there's other aspects to that. There's genetic things, there's, and so there's just extra things that require more attention and more consideration when you think about their care. It's not just them coming in sometimes for the sick visit, typically like, and you're trying to catch them. Like if they're there, we're going to do as much as we can because they're here,
Yes.
And so it's trying to catch up on all those things too.
Yeah. How does that for you as a provider who then you do have to be around kiddos with stomach bugs and with, all the illnesses quite often? How do you like protect yourself? Taking your vitamins every day.
So I actually have made the joke that I feel like I'm in kindergarten again since starting this job.
Really?
I feel like I'm building my immune system because in the NICU, they're not like contagious sick.
Right.
I've never really been exposed to those things so much, and so it's like, I feel like I'm in kindergarten again. And I think I'm just building the immune system back up.
There you go.
Yeah. Lots of hand washing. The number one thing, of course.
Oh yeah.
Lots of hand washing, trying to minimize the face-to-face, like how close I am. If I can.
Yeah.
But again, it's just more about, I think, again, the necessary, like hand washing is number one. And then immediately when I get home, shower, wash hair every time. Like I would never not like, it's just really disinfecting.
I can tell you for me personally, I think y'all are the ultimate superheroes. I'm not even joking you because there's like my one deathly fear is like throw up in life.
Oh.
It is. So the fact that y'all see that and deal with kiddos with that all the time with stomach bug, I couldn't even imagine. So I'm like, y'all are literal superheroes over there. Because I
think in general, healthcare has to feel like that because it's you see sometimes not so great stuff. And I always say seeing things is one thing. Smells are, I'm not gonna lie, I think everybody struggles with that, right?
Yeah.
That's sometimes a little bit harder.
Yeah, absolutely. What do y'all do? Like, we just mask? Do you guys do peppermint oil and masks and things?
No, somebody recommended that to me once, and I think it made things worse for me.
Oh, really?
Yeah, I was joking. I mean, I was having a hard time, and so I was like, I think I'm just gonna tough it out, So
wow.
And some people, have tried like the Vicks in the nose. It's just, I'm more of let's just get things done.
Yeah,
I'm fine. I'll be fine.
Wow. Now, were you practicing during your pregnancy?
Yeah, I was not necessarily practicing, but I was in the full like clinicals for my FNP program. I had a really hard time. A really hard time, which thankfully my preceptors were very understanding if I had to step out to, maybe do the same thing myself, because it was definitely more sensitive and it was a lot harder for me to control that with the pregnancy. And so, that was a little bit
I can imagine.
more challenging.
Yeah. And because that too, you're seeing so many, I mean, because you were in like rotating through different specialties.
Oh yeah. So I did just like generic primary care, any age.
Yeah.
I did like OB, gynecology, OB, pediatrics, of course. So,
wow. What has been your favorite rotation like that you've done?
I think I surprised myself with liking more of what I never thought I would like. So like when you only come from NICU, you think, oh, I probably would never work with adults. I really surprised myself. Like I ended up liking my clinicals, and I was like, that's interesting. Yeah, I was like, that's interesting. And I really enjoyed like women's health. That was like, but I think that was, again, it's kind of one of those easy, like, that's a given for me. Like my background in NICU, like I still had pieces of that, like, and so I think seeing the other side of it was the like fun part for me. So I really enjoyed that for that part.
I love that.
Yeah, that's awesome.
What advice do you find yourself giving nursing students most often?
So I commonly tell people, I really want to encourage you to continue that spirit of, but why? We don't just memorize how to take care of people. It's about understanding the reasoning behind our actions, so that in real time we're responding quickly and doing what's best for the patient. And it also kind of, I add on to, you're not a safe nurse, you're not a good provider if you're not continuously asking questions. It's learning how to be humble and take that humility. I ask questions every day. we don't know everything. We can't know everything. But what's important is that you can acknowledge that and, ask for help. Or even if you think you know it, again, maybe you could know it better or in a different way, or, enhance kind of what you were already doing for something. And so I think there's just something super important about always asking those questions. Because again, I might, I'll feel dumb any day if it means that my patient's going to be taken care of the right way.
Right.
And so I think that's kind of the approach that ultimately I think anybody you ask a question to, they're not going to think that. They're going to be glad that and trust you more and want to work with you because they know that you are doing what you need to do. And if you need help, you're asking for it. So I think that's a huge thing that anybody, not just nursing students, I think anybody could, take a lesson for how do I keep doing that?
Right.
And it goes into your continuous learning thing as a healthcare provider. We don't stop the moment we graduate. It keeps going. You know, things change every year. New things come out. And so we have to keep evolving and going with it. And so
what is your plan as a provider now that you're going to be done with school in May? What is your plan to continue that education for you? What do you think that will look like?
So as far as just provider wise, I think I'm excited to get to choose a little bit more of the specific continuing education pieces I get to focus on to really sharpen, sharpen what I feel like I need maybe a little bit more understanding in. Because right now I'm kind of comped out. School is the replacement for that because you are learning so much. So I kind of have to start looking into those, CE credits and making sure I'm keeping up with that for my license and different pieces. So I think it's exciting to get to decide what my learning looks like and being creative with that. And then, shaping it for me. What does it look like for me? What am I not the most confident in? What could I do better with? And so that's kind of where I hope to go with that piece of it. Now, as far as finishing DNP and how that goes in a general sense, I want to wrap that I have been hopefully into clinical practice. How do I wrap all those things and continue to drive innovation, but scale it? How do I do it bigger? And it impacts not just maybe even the clinic I work for, or the students I teach, but programs across the United States. How do I do that? And so I think that's kind of the exciting piece for me is how do I keep doing the innovative things? And then again, scale it. How do I make that bigger? So
I love that.
That's awesome.
Yeah. I definitely think as we've done this has been a space for us to learn so much more, know? And then also being able to provide with the amazing guests that we've had on, like yourself, that knowledge and education to others has been super rewarding. And I've realized that it's a different way of kind of learning and educating, but it's so fun. And I never personally saw myself as a person who would want to be in the education space in any way. But now that I'm an adult, I've turned into a reader, I've turned into all these things, and it's so rewarding. So
it's
rewarding.
Funny too. I remember being in nursing school, the first one.
Yeah.
I remember thinking for younger teachers I saw, I'm why would you work so hard to become a nurse?
Yeah.
And then teach, and I thought that, and of course it's so funny now because I definitely did that. And it's because you're I can do everything. I can do both. And, I was and it's so rewarding and it was so exciting. And I was I can't believe I ever said that, and I also said I would never go back to school. And I'm on my third program. So, never say never.
Yeah, never say never.
Because so you think you won't, but you do.
Yeah,
you do.
Absolutely. What do you think the next generation of nurses need most from educators and mentors right now?
I think authenticity is probably the biggest piece.
Yeah.
We're supposed to be real world models. Demonstrating, how are we being resilient to things? And then also just acknowledging, I've been there too. And then changing that thought to, okay, let's see how I can help you navigate this. What should that look like? Or what could it look like for you? And I think it's just, again, it's all about leveling with people, being honest, or just being real with them and saying, you know what, I actually don't know the answer to that.
Yeah.
But let's find out together, you know? And so I think it's just a piece of honesty versus just deciding or telling them oh, look that up for yourself. I think that's kind of a huge thing for them is you're working with them, you're partnering with them. It's not like a I'm above you type dynamic. It's I'm next to you type dynamic. I want to work with you. How do I make you become the best nurse? Like I want you to feel like you can do that. And so I try to treat it, you know, professionally in the sense like, yeah, we do have roles that sometimes there's some boundaries to, but I don't want them to feel like it's that dynamic of, you know, that I'm not comfortable enough to ask a question or I can't ask a question. It's, I trust Mrs. Canada to tell me like, you know, that no, that's maybe not the best way to go about it, you know, and be honest back to them, like, and then walk them through where we could go, you know? So
what would you say is one piece of advice or something that maybe stuck with you most from a preceptor or a leader that you had in your time or even now?
I think it's really just been the compassion piece of it. Like it's been like every application I think I filled out for every program, anything I've ever interviewed, anything I've done, it always, like if I had to pull one word from it, it's compassion. And I think seeing that is where that came from, you know, because again, like I don't think that's just like an obvious thing that you're going to read when you're learning how to take care of patients. Like you're learning about disease processes and different pieces of that. And so I think that's made the most like lasting and meaningful thing to me. And it's genuinely shaped my entire career as who I am. And I don't think it was one person. I think it was like multiple examples of how it looked different for people. And then kind of pulling pieces of that and making it my own. And then like continuing it, you know, it's like that ripple effect of like doing a kind gesture and like maybe they'll do that for someone else. And so it's like, that's what I feel like has happened in at least my life.
I love that.
It's so refreshing to hear because I feel like some people get wrapped up into like the monotony of what, you know, they do every day and they just know the answers in the back of their head and like boom, 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 one patient to the next, which is okay. I feel like people fall into that just by habit, but I think it's always important to remember like your why behind what you're doing. I mean, I do it sometimes even like with my job, like, oh, I'm just getting done what needs to be done. Instead of like thinking about, okay, like why am I doing this? You know? So I love that you're really driven by your compassion.
Yeah. What would you say your little one, what would you like to instill in her and for her to see that you model on a day-to-day about like your profession and career and what you do?
I think like naturally in this season that I'm in, I'm starting to feel a lot of that guilt, you know, like the mom guilt of like, I am doing a lot of things right now. And so I think that's definitely something I have asked myself and told myself over and over again, you know, like I want her to know, like, I can do big things. Like my mom did so many things and like, I can do that too. And so I want her to know, like, you're not limited. Like you can be anything. If you are dedicated, you work hard, then it's not a dream. It's your reality. Make it your reality. You can do that. And I think that's like even my own motivator for myself, like, and other healthcare professionals out there, I would say the same thing. Like you can, you will, like that's your mindset. It's not if, it's not, I don't think I can, I'm not sure if I can. It's positive self-talk matters. Like I'm a strong believer in it. And I think like leading with that. And then also again, like not like shying away from the fact that I'm struggling. Maybe I'm struggling and I want her to know like, maybe it's been a bad day, but also how do I handle that? And how am I going to work through that to make, you know, the best outcomes? Because I think when you live in that, like when you allow negative to set in, nothing comes from that, right? Like you feel bad, like, and you're not going to feel better. Where it could be the absolute worst day ever, but I'm choosing to be positive about it. And then again, reflecting on pulling back, grounding myself in my why. And it's immediate, like it's an immediate thing for me, you know, that shifts the thought. I also, funnily, have this like, I don't know, funnily, is that a word? I also have kind of a mantra that I made for myself throughout this time.
Okay.
And I consistently have to say like temporary suffering for long-term reward.
I love that.
You can do anything for a moment. It's not forever. And so I think, again, it's just setting yourself up to keep pushing. And that can look different across the board. You know, I say the same things to students. I'm like, it's all about like, how do I trick my brain to motivate myself?
No, it's true.
Because I'm tired and I don't, you know, I'm like, I totally get that. I'm with you. I'm at the end of my program. I also feel a little bit of that burnout. Like, you know, but it's more about, how can I change the way I go about that?
Yeah.
Mm-hmm.
And then it's like the intrinsic rewards just naturally come out. So it's like, even if I had big goals and I'm going to do 100 practice questions, to get ready for this test, I'm not going to just like sit down and take a 100 question quiz.
Yeah.
Because immediately I'm going to get to, question 20 and I'm going to be like I'm ready for a break. And so you just like blow through those questions. You don't spend any quality time. And then you finish that quiz and it's like you did bad. Like, and it immediately makes you feel like I'm going to fail.
Mm-hmm.
Where it's not really accurate, right? Like it's not truly what you know. It's just because you didn't set yourself up to like truly give in to that moment. And so I'm like, change the thought. Like, I can do a 5-question quiz 100 times in one sitting.
Yeah.
Mm-hmm.
Because 5 questions, easy, done.
Right.
Yeah.
I'm going to spend some quality time there. And it feels so good when you finish it and you're like, you did good.
Yeah.
It's also truly going to tell you if you still need help somewhere.
Yeah.
Right.
Because it's pretty accurate at that point. But it gives you that motivation of like, oh yeah, you feel good because you got like, the job well done, reward on your report. And then, you just keep going and then you end up meeting your goal, And so that's how you approach it. Anything like this, you can do everything. It's just a matter of, how do I do everything?
Yeah.
Right.
And I think it's probably one of your questions too, but as far as like the piece of advice for anybody in healthcare trying to juggle more than one thing, trying to do more, how can I do more? How can I impact more? I think that's the piece of it. Yes, you can do everything. How do you make that look for yourself? Don't forget that leaning into challenges is ultimately how you grow. And like more than anything, the number of things you take on is just increasing your impact factor. Like
100%.
You are changing the level of impact you have by all the things you're doing. And so I think that's like a key driver of that. On top of, there is a point that it's super important that we all, myself included, learn when to say no.
Right.
And when to focus on what truly matters in that season.
Right.
And taking a step back. And, sometimes that means sacrificing your personal life. Like for me, that's been my huge thing is like, I don't feel like I've had a personal life in a long time, and it's not forever, but it's like that support system still behind me. I have a huge number of family and friends and people that have been so encouraging, and which is another piece you absolutely need. I think for the motivating side, but it's like, they're all waiting, they know, and so I think it's just, again, that's the mindset. Yeah. It's not forever. I'm getting there, and honestly, like, even though I've been in school my entire life, it has flown by. Like at this point, I'm like, how old am I? Like, when did I graduate high school? Like, I'm like, no way, know? And so I think that's just like something, it's a blip. Like in the moment, it feels like forever, but you just, eventually you get there and it's like, I cannot believe. I've been a nurse for 9 years. More than 9 years. I don't even know how long now. I'm like, that's crazy to me.
Yeah. I think it's also important to show yourself grace though, too,
Lots of grace.
Like I'm in similar boat a lot with just how I feel like I show up as a mom and for Sloan, just because, we wear so many hats and are trying to achieve so many things. But I think in the long run, it teaches them like, you can achieve anything if you set your mind to it. And I'd much rather facilitate that sort of a mindset in him than, the latter. You're doing a great job. So
thanks. I always need to hear that.
No, so it's definitely inspiring. And I love what you said about like just shifting your mindset, because it's true. It's a like psychology game. You can sit there and play with yourself, because there are times where I'm an overthinker. So there are times I'm in my head and I'm so just like negative. And the second I switch to like one positive thought, I'm like, oh, my mood, it feels lighter. I'm like, oh, like it's such a, it's crazy how much you can trick your brain into like, being positive.
It's a huge thing.
I am curious, like being on the provider side of medicine, do you feel as though sometimes you've even experienced this as well, like mindset and attitude can sometimes defy medicine and odds, like like just in like the faith and hope sense, like of how of healing.
I am definitely a trusting person that God can do anything he wants to, and he does, like, and sometimes that defies those odds, right? I also think too, it's sometimes God created us and people in our life to help us become healthy, get healthy, do the things. And so, I definitely lean into both sides of it, but I'm not somebody that, if you want to try something, I'm going to give you lots of education.
Yeah.
Because that's my job.
Yeah.
Right.
But also, I'm happy to work with you. I'm happy to see how that, see how we can maybe do both, come to a compromise.
Yeah.
If it's like, we need to do something type, situation. But I don't limit myself to that. I definitely think that, I don't feel like I've personally seen just something that's like I guess one of those like no possible outcome would come to this without God. I haven't necessarily seen that, but I feel like seeing the way God moves in certain situations, especially I think mostly in my like NICU career, on those like, it's 98% wonderful, 2% really sad, sometimes. And those 2% times, I mean, there's something in that moment.
Yeah.
That like seeing that mama, that daddy, like, sorry, this always gets me.
You're good.
Seeing them come through that. And I think that's, like, to me, that's where God's at. He shows up. And so it's like, I can't do that. Medicine does nothing for that. Right. And so I think it's, for me, that's at least where I've seen it the most.
Yeah.
Sorry.
I'm sorry. We don't have tissues.
We usually have tissues.
I'm sorry. I'm like really emotional as well. Like I just feel like every day it's just such a blessing, and like that God laid this on our hearts to be, to be who we are and to show up and lead and to love, and disciple through our passion and our purpose. And I love the emotion. So don't at all. Yeah. Don't at all.
I think there's something to be said about the mindset piece of your health. It's like the placebo effect, right?
Yeah. Yep.
If I think that stress relief lotion works, it does. Like, because I believe that it does.
And keep using it. Like,
and so I think that's our side of, your team that's backing you. You want somebody that believes that anything's possible. We give facts, but it doesn't stop there. And I think that's kind of the added piece of kind of what you're thinking of. Yes, absolutely. And it's, I think, just being the support and then being there. Like, you don't even have to say anything. I think in a lot of situations, just listening and saying like, I care about you and I care about what you're saying, and that immediately, like, we're up here, we're down here now.
Right.
And then sometimes you end up coming to really great compromises that you may have not gotten to. That ultimately is the best thing health-wise for them. But, it's still what they want to do.
Right.
And that's most important, because, I mean, you can talk all day, but if they're not, your patients, their family members, if they're not on your team, there's nothing's going anywhere. You know what I mean?
Yeah.
And so I think you can set into that. You were told this, that's it. And I don't want anybody to ever feel like that's the end. I think it is adding in the extra side of anything's possible. It's not just for me. The medical brain, it's definitely there, and I speak to it, but it's listening and allowing them the opportunity to lean into the other side of their faith if they wanted to do that.
Right.
But of course, like, being respectful of like everybody's differences, and I'm open and receptive, but never pushy, right? That also is deterring for a lot of people. And so I think you need to learn how to balance that. What does that look like too? To where it's in the background, but it's not necessarily like something that's going to maybe negatively influence them either.
Right.
And that's a hard skill as well. How do I be me? And do I feel called to do?
Right.
But also like do my job and professionally and what I'm expected ethically to do. So that's a huge conversation topic. But
Yes. Yeah. How do you feel as though your office, your practice, how do you feel as though y'all work together to facilitate that as a team approach?
I feel like we have just the best team.
Really?
Like, honestly, everybody is so communicative. We talk about things. Again, I'm not shy to ask questions. I don't think any of us are. And they're always ready to answer and to help and, to take a look after you if you are asking for it, and I think we really have kind of spearheaded that. And then of course we talk through things and it's like, hey, like, what are y'all doing for this? Like something we're all struggling with trying to find a resource for, or, you know, and so I think like we bounce those ideas off and it's just like a continuous, like, I don't feel like the team dynamic goes away at any point in time, even though you're by yourself in a general sense throughout the day.
Yes.
But it's still like in the background working in different pieces. So
that's
phenomenal.
Yeah.
Could never say anything bad.
Yes. I love that. It's so important too, because knowing that you have that team, you know, to lean on and to ping things off of. And I mean, that I think that makes us like better providers, like, you know, because we're just one team approach of a unit. And so better overall care, I think.
Oh yeah, for sure.
Yeah. Agreed. What's one thing your students or patients would be surprised to learn about you?
So I really like this question. I think they would be very surprised to find out that I love and listen to almost all genres of music.
Really?
This does include like punk rock, some screamo, depending on the band.
Really?
And my favorite concert to date would be Def Leppard and Kiss.
Really?
I think that also maybe could kind of key them in on my favorite color.
Yeah.
Okay.
Which maybe fits that personality, right?
That is so funny.
But also like, you know, worship music, country
Yes.
music. Like I genuinely love it all.
It all. That is so awesome. Is there somebody in your life that just introduced you to all? You've just always been that way.
Yeah. Okay. My husband always thinks it's funny too. Like, you know, we could be out and there's music or something playing and it's like an old song. Like, and he's like, how do you, and I'm singing it. Yeah. And he's like, how do you know this? I was like, I have no idea.
Don't know. I just
I'm like, I have no idea. And I love it. Like, even like the songs your grandma would listen to, you know what I mean? Like, I like those too.
Yeah. That's awesome. So if you had to pick if you had to pick a top soundtrack or playlist to burn and turn in on your way to work or in the office, what would it be?
I think like things that are calming are best, right?
Okay.
So that's either worship music, which primarily is what you'll hear on my computer. Or I really love like Benson Boone, Callum Scott. Of course.
Yes.
Like those are just like the feel good. Like you can't be sad when you listen to that, right? And so definitely probably those because it's more about the calming side. And then of course the other ones that seem a little bit more outlandish would be like I need to quiet my brain and drown out a thought. And I'm not thinking about anything.
So that's like the drive home playlist.
Sure.
Okay, there you go.
Yeah, sure.
I'm kind of similar in that sense. And mine's very like mood dependent or what I'm doing. So like if I'm at the gym, like people would be surprised to see what my gym playlist has on it. Like there's people screaming in these songs or it's hardcore rap. And it's like cuss word every other word. And I'm like, sorry, God. And then like in the morning, I'm like, worship music. So it's like very mood dependent or what I'm doing. But, you know, I get it.
I would say it is. It's a mood thing. Like, I feel like it just changes literally every day. And also just like minute to minute. Like I listen to one song, I'm done with that. Let's go on. So I think that's a huge factor for me too.
Absolutely.
I love that. That's awesome.
If you were in nursing or if you weren't in nursing, what do you think you would be doing instead?
Ooh.
So definitely something creative, like interior design.
I
always say it's like my hidden talent. I love doing that. Lots of mood boards. Also the organizational thing. I've got a major knack for that. I think I'd have to, right, to do even what I'm doing now. So I think event coordinating, planning, you know, even adding in the design pieces to that, like in not just like organizing the schedule of it, but like creating the whole thing. And so I think that would be like fun for me. So fun.
So did you have a wedding planner or did you do it yourself?
No, I did it myself.
Love that.
Yeah.
I love that.
Our story is super fun. Like he's my high school sweetheart.
Oh.
And so we dated for a few years. I was older. You know, I went to college and then we broke up for a little bit. Didn't talk for an entire year. The next year we were absolute best friends, like talked every day, hung out, genuinely friends for a year. And at that point I kind of like came to terms like, well, okay, like we're probably not going to ever be more than this. And then out of the blue, like he's like, hey, if we try things again, I'm like, what? It's like, oh,
okay.
I decided that we weren't, you know? I finally accepted that. But anyways, it was like, the moment that happened, we started dating. He proposed 3 months later.
Oh,
well, I guess a little bit later.
And he's a twin, right?
No. A lot of people think that with the.
Are you kidding?
They're like a year-ish apart.
Oh my God. They look identical. I'm like, oh
Yes,
my
a lot
gosh.
of people think that, but he is like a year and some change.
Okay.
over.
Okay.
Yeah.
That
Oh.
is so funny.
Yeah.
Wow.
But it was super cool because
Yeah.
like by the time like we got back together January, he proposed in July, and I planned my entire wedding by myself. Really in probably like 2 weeks, if I'm being honest. But I got it all done, and we got married in October. And
Oh,
that's
wow.
awesome. And now we've been married for 8 years.
Oh my God. Wait, when's
I
your
love
anniversary?
October 28th.
Okay. Okay. Ours is the 30th. So
Yeah.
Oh, that's awesome. I love that. We didn't have a wedding planner either. So
No.
it's such a fun thing. Like all the little details. Oh my gosh. It can be stressful, but I think like-minded on that. Like all of it's so fun.
I
though.
think that's
Yeah.
like my leisure
Yeah.
activity. Like
Yeah.
if I'm going to choose a leisure activity, that's usually my kind of go-to. Like I'm like putting things together and I'm trying to create
Right.
like fun things or,
Yeah.
Wow.
home inspos,
Yes.
outfits,
Yeah.
whatever. And it goes nowhere. It's just for me.
Yeah.
You know,
It's just
me.
fun.
it's just for me.
Yeah.
But it makes me kind of detach
Yeah.
and
Yes.
not think about too much else. So
Yeah.
Agreed.
That's awesome. We all need those. Okay. What is your coffee order during a long clinic day or lecture day?
So I really just like black coffee with a smidge splash of like Irish sweet cream.
Okay.
I really do not like coffee that doesn't taste like coffee.
Oh, okay.
Really?
Good deal.
Okay.
Yeah. There you go. I went through a small
Oh,
black
man.
coffee phase, but now I'm like, let's spice it up a little bit.
Yeah, I like a little just to take that like bitter edge
Uh-huh.
off, but I still want to taste the coffee.
Yeah.
Okay.
You know what I mean?
Yeah.
I
Absolutely.
cannot do
Interesting.
the super sweet. It
Yeah.
can make me sick to my stomach.
Yeah. for sure.
That's me. I need sweetness in my coffee. That's why I just don't drink coffee. Because all the milk and sugar, it upsets my stomach. So
Oh,
I'm
yeah.
like, eh.
Yeah.
I don't like it black, so we're just not going to drink it.
There you go. Solution. Okay. Let's do rapid fire.
Ooh.
Early riser or night owl?
Night owl.
Night owl. Okay. The mind awakens. What do you do? Like what or
Oh, I'm just working all the time.
Okay.
Yeah, I'm
Yeah.
just working all the time. I just feel like I function better at night because it's quieter
Uh-huh.
in the world.
Mhm.
And so it's just easier for
Yeah.
me. Of course,
Mhm.
baby's asleep. That's
Yeah.
really helpful for me.
Yeah.
And so yeah, definitely night owl. I'm
Okay.
not a morning person.
Okay. And clinic or classroom?
Clinic/clinical setting.
Okay.
You know what I mean? Like I don't
Yeah.
love
Okay.
the
Yep.
classroom lectures as much, but I really love clinical teaching. So
Mhm.
definitely it's the clinical focus.
Okay. Pediatric or okay. PD kids or PD parents?
Both because
Okay.
I need everybody on my team.
Yeah.
You know what I mean?
Yeah.
Like
Mhm.
I can't choose. Like
Yeah.
we have to be all on the same page.
Yeah.
Right.
Yeah.
Right.
Okay. And finally, what is your biggest piece of advice for anyone chasing big dreams in healthcare and wearing multiple hats?
So I touched on it a little bit, but again, it's the mindset.
Yeah.
You can, you will. Just do it.
Yeah.
Leaning into the uncomfortable, the challenges, that's growing you. And again, it's the mindset of like, it's temporary. I
Yeah.
can do this. Anything short, ultimately for a huge impact is, to me, it's worth doing, right?
Mhm.
Especially if you thought about it more than a few times, like there's something that's calling.
Yeah.
It's a calling on the heart, and I always say, don't ignore that.
Yeah.
Because what's the point?
Yeah.
Eventually, I think you'll get to that in some form or fashion. And so, waiting is never the option.
Right.
There's never a good time to start. You should just do it.
Mhm. I agree.
Just
I
start.
love that.
Same.
Yeah.
We've had to realize that over the past year or two on a lot of different things. Like,
Yeah.
let's just do it. Like, why are we talking about this? Like
Yeah.
5 different times. Just do
Yeah.
it.
I fully believe that. I mean, if it is a multiple occasion thought, or if it's something that you're just feeling so drawn and called to do, like the Lord has really laid that on your heart. It's
Mhm.
not just this may be fun. Like, no, it's a calling. So yeah, I love that.
Well, and I think when you choose to do things that are hard and not fun in the moment, it's a calling, right? I mean, because
Absolutely.
you can't survive that without the nudge. So
Mhm. Absolutely.
Absolutely. Well, thank you so much for coming on. We
Yes.
appreciate you. And
Yes.
you're so like inspiring because you just wear so many different hats. And it's like really cool to just like sit and listen to your story. And
Mhm.
especially being a new mom, like you're killing it. So I know you said you need to hear that, but seriously,
I will continue to accept that compliment.
Seriously, you should be super proud of yourself. And congratulations on almost being done with your doctorate program.
Yes.
Thank you guys.
Thank
This
you.
has been so fun.
Thank you.
So
Thank you for what
appreciate
you
you.
do for patients and our tiny friends in this community and the families here. So we appreciate you. Thank you guys. Tune in next time.